Hello, everybody. This is Ralph Martin, the owner of BestFitnessDevices.com. And in this video, I want to answer the question, how does sleep apnea affect your heart? Sleep apnea affects millions of people around the globe. In fact, according to the National Lung and Blood Institute, nearly 18 million Americans suffer from some form of sleep apnea. But how does sleep apnea actually affect your heart, which is the whole point of this article? First of all, we want to answer the question, what is sleep apnea? And, just from this diagram that you see on the video here, as you can see on the left, this is kind of a normal view of somebody who's not suffering from sleep apnea. And if you look on the right, this is a diagram of an individual who has their airway blocked due to sleep apnea. So this is sort of a visual of what sleep apnea actually is. And typically you'll hear things like a momentary stop breathing episode, or most common one is snoring. Usually that is one of the outward indices. So sleep apnea, by definition, is a condition where breathing stops for a short period during sleep. There are two main types of sleep apnea. There's obstructive sleep apnea, otherwise known as OSA, which occurs when the airway becomes blocked. And then there's something called central sleep apnea, CSA, which happens when the brain fails to send signals to the muscles controlling breathing. OSA is much more common than CSA, so we'll pretty much be talking about OSA. So the most common cause of OSA is obesity. Other risk factors include, male gender, older age, and genetics. Obesity causes the tongue to collapse against the back of the throat, narrowing the airway. This makes it harder to breathe through the nose, and the obstruction may be either temporary or permanent. If a person stops breathing for 10 seconds or more, he or she will typically wake up. This is called an apneic event. During this time, the brain senses that oxygen levels are low and triggers the body's flight or fight response. This result typically is increased blood pressure and increased heart rate and respiratory rate. So these symptoms can last several minutes. When repeated over many hours, they can lead to serious health problems, such as high blood pressure, stroke, heart attack, irregular heartbeat, and even death. So specifically, how does sleep apnea affect your heart? You may think that sleep apnea doesn't affect your heart, but it actually does. When you stop breathing during your sleep, your brain sends a signal to your body to wake up so that you can breathe again. But when you stop breathing for long periods of time, your body starts to work overtime to keep you alive, of course. And then your heart works harder than normal. And if you have several sleep apnea episodes, your risk of developing heart disease increases by 50%. If you already have heart disease, you're at a greater risk of having a heart attack or dying suddenly. Sleep apnea also puts stress on the actual heart muscle itself. And these muscles must pump harder to get enough blood flow to your vital organs. So over time, this can damage them. It can also make your arteries stiffer. As a result, your blood vessels narrow, which reduces blood flow. And sleep apnea also leads to high cholesterol and triglyceride levels in your bloodstream. And this can increase your chances of getting clogged arteries, which also affects the heart. A study published in the Journal of Clinical Endocrinology and Metabolism found that patients with untreated obstructive sleep apnea had higher levels of C-reactive protein. In other words, it's called CRP, the marker of inflammation. The CRP has been shown to predict future cardiovascular events. So, what can you do about sleep apnea, knowing that, these are issues? If you're watching this video on YouTube, you can click the link in the description box that will bring you to this post that or article that will detail everything I'm talking about. I encourage you to read it. There's a lot of good information on there, and there's some really good statistics and really good references that I believe you should read. So obviously we know that sleep apnea does affect the heart. Um, there is a percentage distribution that we show in here, which are 10 leading causes of death, and heart disease being one of them. So this is a pretty critical um, article I think that you should read. Sleep apnea treatment. So lifestyle changes, of course, losing weight. If you smoke, quit smoking, avoid alcohol, and exercise. Regular exercise is essential for maintaining obviously a healthy lifestyle, but it also increases your overall health and helps reduce stress. And this will lower the chances of sleep apnea. There are medical treatments for sleep apnea, surgery, CPAP therapy, and I encourage you to read this article to get all of the details. And go ahead and click on that link. And if you found value in this video, feel free to subscribe to my YouTube channel and then read the article. Feel free to send any comments or questions, and I will certainly answer them right away. This is Ralph Martin signing out. You make it a great day. Take care.